Hi, everyone. Dr. Lindner. Okay, let's continue with some basic anatomical terminology. So we'll get into some body positions, some regional names, directional terms, planes, and sections, and we'll talk about some body cavities. So anatomical position is the standardized method of observing or imaging the body that allows precise and consistent anatomical references. Here, the person is standing tall. They're standing with their feet flat on the floor. They're standing tall and erect, facing the observer. The upper extremities are placed at the side. The palms are facing forward or anteriorly, and the feet are flat on the floor. That is the basic anatomical position that we study the human body in. And every time we use a reference term, you have to think of an individual standing with their palms facing forward, feet flat on the floor, as we see with this individual on the left-hand side. So let's get comfortable with some of the terminology here. So when we look at the face here, you'll see that right here in front of the skull is the frontal bone. On the side is the temporal bone, the temporal region. The eye is called the orbit. The ear is called otic. The cheek is called buccal. And you'll see when we do muscles, there's a muscle called the buccinator. There's a muscle called the frontalis. There's a muscle called the temporalis, right? So muscles can be named based on their location next to the bones that they're next to. The nose is nasal. The mouth is oral. The chin is called mental. When we do osteology, you will see that there are holes here called foramen, and where holes are found, blood vessels and nerves typically travel through them. So they're called the mental foramen. Here, the cranium and the face combined is called the cephalic region. Cephalic really means head. The neck is called the cervix. Now let's look at the trunk, which is composed of the chest, which is the thoracic region, the abdominal region, and then the pelvic region. The belly button is called the umbilical. The breast is called the mammary, and the chest bone or the breastbone is called the sternum. The armpit is the axilla or axillary region. The arm, where the humerus is called brachium or brachiole. In front of the elbow is the antecubital. The forearm is called the antebrachium or antebrachial. The wrist is called carpal. The palm is called palmar, and the digits are called phalanges. The thigh is called femoral. That's because the femur is here, the longest bone in the body. The kneecap is called the patella. The leg is called crural. Where the ankle joint is tarsal. So in the wrist was carpal, in the foot it's tarsal. Then once again, you have digits of the foot, which are also called phalanges. The thumb is called pollex or pollicus, whereas the great toe is called hallux or hallicus. The top of the foot is called the dorsum. The dorsum of the foot is the top of the foot. Underneath the foot is called the plantar surface. Plantar surface. The back of the head is called the occiput or occipital region. Here's the scapula. Here's the vertebral column. The back is called the dorsum or dorsal. The lower back is called the lumbar region. The sacral region is here. The rump is the gluteal region, and when we do muscles, there'll be a gluteus maximus, medius, and gluteus minimus. When you look at the lower limb, in the back of the knee is called the popliteal. The calf is called the sural. The heel is calcaneal. And again, underneath where the sole of the foot is called the plantar surface. This is the lower limb, and this is the upper limb. In the back of the elbow is called the olecranon. The olecranon. Some other terminology. When we're looking at the extremities, like the upper or lower extremity, the arm or leg, when you move further away from the beginning point, we call it moving distal or distally. And when you're moving closer to the beginning, it's proximal. So if I'm talking about the humerus, this is the proximal humerus, this is the distal humerus. Okay. When I'm talking about the body as a whole, we use the word superior as the high up point. And as we start moving downward, we're moving inferior. So the head is superior, whereas the sacrum and coccyx would be more inferior. When you're right at the midline and you start moving away in either direction, to the right or to the left, again, in anatomical position, to the person's right or to the person's left, we say we're moving lateral or laterally. If your starting point is lateral and you're moving towards the midline, we're moving medially. So these are really important terms: medial, lateral, proximal, distal, superior, inferior. There's also superficial and deep. So if we're looking at my skin, the superficial is my epidermis, and if I start going deeper, I'm looking at the dermis. Superficial and deep, superficial and deep. Contralateral and ipsilateral. Ipsilateral means same side. Contralateral, contra means opposite side. So if the patient came in after an accident complaining of right shoulder pain, and the report says right shoulder pain with ipsilateral wrist pain, it means right shoulder, right wrist. If it says patient came in with right shoulder pain and contralateral foot pain, then it means right shoulder, left foot. So yes, you should be comfortable with superior, inferior, medial, lateral, ipsilateral, contralateral, proximal, distal, superior, and deep. The only one I didn't mention was anterior, posterior. Anterior is what you see in the front. Posterior is what you can't see, which is on the back. Okay. So if you say, turn around, I want to see you from the posterior, you're asking the patient to turn around backwards. What you see in the front is anterior, also known as ventral. What you see in the back is dorsal, AKA posterior. Planes. So when we have a plane that separates the body into equal right half and left half, that is going to be the mid-sagittal plane. That's right through the midline of the body. Parasagittal is not going to create equal distribution on left and right side, but generally speaking, sagittal is going to go this way, separating into a left and right half. When we have something in the frontal plane, it's going to separate the body into front and back halves. So the frontal plane, also known as the coronal plane, going in alignment with the coronal suture in the skull, that will separate the body into an anterior and posterior. And then we have a transverse plane that will separate the body into an upper and lower half, giving you like a bird's eye view looking down into something or looking up into something. So if we relate this to diagnostic imaging, we can look at the brain in different planes. We can look at it at a mid-sagittal section or a sagittal view, looking at a left and right half. We can look at the frontal section or coronal section here in the middle, looking at it from front to back or back to front, in which case you see some on the left and some on the right, or in anatomical position, right and left. And then there is the transverse, right, which is a cut in this direction, looking at a bird's eye view, looking down into it. Now, when we talk about body cavities, right in the center, we have the cranial cavity and vertebral cavity. And that's going to house the brain and the spinal cord. Then we have a thoracic cavity. The thoracic cavity is going to house the lungs and the heart primarily. The mediastinum is the central portion that's between the lungs it's behind the sternum, but in front of the spinal cord. And it's this passageway that some major blood vessels are going to travel through, along with your esophagus and your trachea and your windpipes. Down here on the bottom is the abdominal cavity and the pelvic cavity. Abdominal cavity is going to have most of your digestive organs, and your pelvic cavity will have some of the reproductive organs. So when we talk about these in particular, especially thoracic, abdominal, and pelvic cavity, we're going to have some membranes cover them. And the serous membrane is this double layer membrane that's going to cover the viscera, meaning the organ, within the thoracic cavity and the abdominal cavity. Now, the two main layers are the visceral and parietal layers. And the purpose of the serous membrane is to try and reduce friction between organs, creates a slippery surface. Visceral is going to be the layer closest to the viscera or the organ, and the parietal is the outer layer. So if I were to take, let's say, my fist, and let's say this is a balloon, and I push my fist into this balloon, the balloon is going to take shape going around my fist. Okay, now let's say this is the heart and this is a balloon. The heart goes in, the layer that's contacting the organ is the visceral layer. And the layer that's on the outside, the outer part, is the parietal layer. Okay, so if this is the heart, this is the visceral pericardium. And if this is the heart, this is the parietal pericardium. If it's the lungs, we just take the word pericardium out and we put the word pleura. So here, if we look at the heart in the center, we see the visceral pericardium is on the layer that really comes into close contact with the heart. The layer on the outside is the parietal pericardium, and the cavity is in between. That's the pericardial cavity. We apply the same concept to the lungs, but now we take out the word pericardium because it doesn't have anything to do with the heart, and pleura refers to the lung. So there's a visceral pleura, which is that serous membrane that comes into contact with the lung. Then there is the parietal, which is closer to the cavity, right to the rib cage itself. And then between the two is the pleural cavity itself. The same concept will apply to the abdominal cavity, where you have the peritoneum. The peritoneum is the serous membrane that covers the organs. And again, there'll be a visceral peritoneum and a parietal peritoneum. So the peritoneum is going to cover the abdominal organs. When you hear the word retroperitoneum, these are organs that are not contained within that peritoneum, but posterior to it. The kidneys are an example of that. The pancreas is an example. Those are behind the peritoneum. Okay, that's why pancreatic cancer is so painful. When it expands, it's going to push up against all of that peritoneal cavity and create a lot of pain. Okay, and now let's look at the 4 quadrants, the abdominal quadrants, and the 9 regions. So we have a right upper quadrant, a right lower quadrant, left upper quadrant, left lower quadrant, and you should be familiar with the primary organs in each. So patient came in with right lower quadrant pain and a fever. Most likely the structure involved may be the appendix. Patient came in with right upper quadrant pain on palpation, meaning touching that area. We noticed that the eyes were jaundice or yellow and the skin was jaundice or yellow. Most likely there's some liver damage. Okay. Patient came in after eating a fatty meal, and went to the bathroom and their stools did not sink but floated. That means poor fat metabolism. Most likely, right upper quadrant pain in this particular scenario is a gallbladder dysfunction. Okay. In the region, similar concept, the center where the belly button is, that's the umbilical region. Above it is epigastric. Epi means above, gastric is stomach. There's an epigastric, then there's a hypogastric. Near the lumbar region, there's a left lumbar and a right lumbar, sometimes called the left flank and right flank. Then there's a left inguinal and a right inguinal region, a left hypochondriac and a right hypochondriac. Then you have these lines here are mid-clavicular, right? Here's the clavicle, so that's mid-clavicular. This is mid-clavicular. So you should know the body as 4 quadrants and 9 regions and have a general idea as to what major parts are found where, okay? In terms of medical imaging, just generally speaking, sometimes we can look at structure. We can't see it, so we have to do some form of diagnostic imaging, and it helps us to be able to look at structure, match that up with function or dysfunction, and it helps us come up with a diagnosis a little bit easier. So there's lots of different diagnostic imaging. Many of you are familiar with maybe a radiograph or an X-ray, in which it's great at picking up hard tissue pathologies or looking at anything that's calcified. Then we have MRI or CAT scan. These are great images. When we look at an MRI, it's relatively safe. It cannot be used with people that have maybe glass in their eye or metal fragments in the eye, or maybe have a pacemaker. They have to know this ahead of time because it's magnetic. I remember about 25 to 30 years ago, there was a local radiology center on Long Island in a nearby town that did not do a proper screening on a patient with a pacemaker. The patient went in, but came out dead, okay? It will just rip apart anything with metal. So a very, very thorough assessment needs to be done. And this question is asked all the time, right? I mean, before I send my patients for an MRI, I ask. And then certain metals may be okay, like certain implants. If someone's had a prosthesis in their hip or a hip transplant, some of those are okay, but it's still important for the radiologist to know. Then when you get to the radiologist, the front desk help, they will ask. And then before you go in again, the radiologist or the technician will ask again, any glass. The question can't be asked enough. Okay, so it's basically a pulsing of these radio waves are going to, with a magnetic radiation, it's going to create this high energy field, this high energy magnetic field. And it causes the protons, right, the small positive particles with atoms like hydrogen, in the body fluid tissues to arrange themselves in relation to the field. And the pulse of the radio wave reads the ion patterns, and a color-coded image is going to be assembled through the monitor. It's pretty cool how an MRI works, usually for lots of soft tissue, okay? For brain, for spinal cord, for discs, really, really good. Same thing with CT. Computerized tomography, a CAT scan. In this case, you're not going through a full tube. It almost looks like a donut that you're going through. With MRI, it's usually, if it's recumbent, it's typically a tube, a full tube. But in a CT, it's usually a donut-looking structure. So this one is an X-ray beam traces an arc, right, at multiple angles around a section in the body, and it results in traverse sections. right? They can take different slices, if you would. So really, really great at looking at the heart, looking at the lung, looking at different cancers, looking at coronary artery disease. I went for one of these proactively a few months back, called a cardiac scoring. Literally was 4 or 5 minute exam, but it was done through CAT scan, and they call it the lifesaver test. Insurance companies don't cover it, but for $100, it looks at the major blood vessels and looks at the amount of calcium in the major blood vessels and scores them. Great test. Ultrasound, very safe. It's non-invasive, painless, no dyes are used. This could be used to visualize the fetus during pregnancy. They take measurements to look at the size of the skull, to make sure all the organs are intact, that the brain is there, the heart, the spinal cord. So ultrasound is sometimes referred to as sonogram. They use this high frequency sound wave that's produced by typically a handheld wand, and it's going to reflect off the body tissues. Okay, and it's detected by the same instrument, and then it produces this image. They use it for babies, and they use it to look at abdominal organs, and they even use it on blood vessels. They call it Doppler ultrasound. Endoscopy, sometimes you've heard of colonoscopy. This is where they put a visual camera, an instrument or a lens inside the body. They call it an endoscope. And they could do a colonoscopy here, as seen in this picture. They could use it as a laparoscopy, which is used to examine organs within the abdominal cavity. They can use it in joints, called arthroscopy. So it's really neat technology to be able to see. And if it's a colonoscopy, then they can look to see if there's polyps there. And if there is, they can remove it. They could send it to a histologist or a pathologist to make sure that they're benign and not malignant. And to finish up, in terms of aging and homeostasis, it's kind of one of those common things that we know, that as people age, just some of the processes start to slow down. They start to decline. The body's ability to heal, the body's ability to restore homeostasis just takes a little bit longer. These terms: disorder is just any abnormality to function, right? You have order and then disorder. You have ease, then you have dis-ease, which is a homeostatic imbalance with distinct signs and symptoms. Signs are changes in bodily functions that the physician or the observer can see. Maybe they have a rash, maybe they have a fever. Symptoms are typically what the patient can express. Oh, I feel nauseous, or when I move my head this way, I have pain, right? Those are symptoms. I can then take that along with blood work. I can look at x-rays. I can look for certain signs that when I take the patient's symptoms and I take the signs of certain testings that I do and I put them together, then I can come up with a diagnosis, which is the skill of distinguishing a differential from one disease from another disease.